So for this talk, I'm very pleased to introduce Ms. Karishma Muthukumar, who is cognitive science graduate at the University of California, Irvine, and Mr. Pratyush Muthukumar, who is a student at Stanford University. Please welcome on stage. Over to you.
Hi, my name is Karishma Muthukumar.
And I'm Pratyush Muthukumar.
We're siblings, Gen Z innovators, and we're here to share our innovations and perspectives on artificial intelligence.
And its capacity for doing good in society.
So we were both students at the University of California, Irvine.
Actually, we were in some classes together.
Yeah, that was fun. And we worry about everything.
And ChatGPT wasn't around when we were in college.
Yup. We worry about exams, we worry about the internet, and we worry about whether we will belong. And we believe that empathy based AI is the future.
The UN has a list of 17 goals to transform our world. And one of these sustainable development goals is good health and well-being for all. We have less than 10 years to reach our targets. So we believe that the time is now and the way is AI. In our increasingly AI interconnected world, we believe that AI will play a larger role in ensuring the good health and well-being of all.
We believe that empathy based AI that combines the human values of empathy and compassion, is the solution. So, to understand this, we first start with our origins in the analog world before the era of technology, our movement into the digital world, and finally, our movement into the AI world. So, how do we want to build and shape this AI world? How and why should AI impact healthcare?
So, to motivate our discussion, we take a look into research comparing physician and AI chatbot responses to patient questions posted on social media. Now, physicians and ChatGPT were given the same questions sourced from the internet, and scientists found that patients rated ChatGPT responses higher in the scale of quality and on the scale of empathy. Now, to even consider the level of tech assisted care reaching, let alone exceeding that of the human touch, is mind blowing.
So, to understand this, we want to identify both strengths and opportunities for both AI and for humans. How can we create a human machine synergy? What is empathy and how can we put that into context? Is urgency a priority? Is being concise a priority? Or do we appreciate 5 paragraph essays on the topic? Are we looking for a lived experience or complete knowledge of the internet?
Humans and AI have their individual strengths. At their center, where these strengths overlap, is the opportunity for innovation and collaboration. So, what is empathy? Empathy is hard to define, believe us. As a computer scientist myself, I wish there was just some elegant formula defining empathy which I could plug into an AI model. Well, since that doesn't exist, let's just Google it. A simple search defines empathy as the ability to share and understand the feelings of another. So, how can we use AI to create personalized definitions of empathy?
So, to understand this, we want to identify what is empathy. And today we'd like to present two innovations. Meeting a patient with locked-in syndrome who is locked into their own body, whose communication is limited only to their eyes, inspired us to create a novel medical language interface. Research shows that about 40% of communication sessions in the ICU are unsuccessful, and 62% report a high level of frustration. So there is a need for an alternative that combines these core values of speed, accuracy, and reliability. Research also shows that emojis are able to convey nuanced meanings, often better than text alone. Emojis also are able to evoke emotional responses similar to face interactions. So, and emojis are able to cross language and cultural barriers. So we're able to use artificial intelligence to personalize and streamline this mode of communication by selecting these groups of emojis. So here we have tabs for specific preferences. We have health-specific emojis for particular conditions, and we're able to streamline and personalize a novel medical language. And so we're able to use eye tracking and brain-computer interface to be able to select these emojis, and artificial intelligence helps to group these select groups of emojis.
Our second innovation is an AI chatbot. In the last few months alone, we have seen unprecedented levels of progress in these large language models, reaching scales in the order of terabytes of training data and billions of model parameters. And in designing these models, it's important to take special care to ensure that generated dialogues are safe and constructive. The LLMs of today have numerous upsides. They are remarkably consistent and are available 24/7. But would you trust ChatGPT to help you decide between two competing job offers? What about coping with the loss of a loved one? So, how can we make AI models more compassionate? Well, believe it or not, it turns out that humans are pretty much the world experts on empathy. So much so that it has been found that the human brain applies empathy in situations using advanced algorithms parallel to those researchers in the field of reinforcement learning see. So, our
So
idea
idea
was
was
simple.
simple.
We curate a set of empathetic dialogues and we throw an AI model into it. If the model performs similar to that of an ideal empathetic person, we reward it. If not, we penalize it. Sort of similar to how we might teach a pet to be on its best behavior. So we collected a bunch of empathetic tweets, conversations, and dialogues and gave it a shot. And it turns out that our model is statistically less perplexing to understand and more effective at holding a higher quality conversation for longer. But don't just take our word for it. Here's some conversations we had with our model. It's called Empathy Gale, compared to ChatGPT, which you're all very familiar with. And we also consulted our expert empaths in residence. And by that, I mean us humans. Take a look at how our model responds to a very galvanizing emotion, anger. And here we'll see the expert crowdsourced human empathetic dataset response here, as well as ChatGPT's response followed here. So we had another conversation with our model, this time for another very powerful emotion, sadness. Take a look at how our model responds to news of a very tragic event compared to that of ChatGPT's and of our expert human empathetic dataset. And interestingly enough, we found that our model sometimes generates made up conversations to better relate to the experience. And I think that's an important insight into how we interconnect and intercommunicate with each other. And it's certainly insightful. Usually, the strongest bonds are formed through the most shared connections.
So where can empathy AI be applied? It can be a wellness chat system for daily check-ins and regular support. It can be a conversationalist in the hospital waiting room in times of elevated anxiety and isolation. It can be a tool for patients who struggle to communicate, for patients in the intensive care unit. It can be a voice for patients who are unable to communicate, for patients with locked in syndrome, for patients who are paralyzed. We believe that compassionate AI is a step toward compassionate care.
The COVID 19 pandemic has accelerated the adoption of virtual care. In the United States, telehealth visits are up 154% in March 2020 compared to that of the previous year. Personalized medicine, enabled by AI, is gaining increasing attention. The global AI in personalized medicine market is expected to reach 3.5 billion USD by 2025. Regulatory bodies and government agencies are developing frameworks and guidelines to ensure the responsible and ethical use of AI. For example, the European Commission's proposed regulation on AI seeks to identify potential risks and safeguard human rights.
Interacting with ChatGPT teaches us. For example, there are a set of best practices that have emerged. It's good to start with a persona, like imagine you're a systems engineer or imagine you're a literature professor. It's also good to include a format. Please provide a bulleted list or please provide a paragraph description. And we continue to learn more each day, but the point is, how does interacting with AI affect human empathy?
What should we learn from the strengths of AI, which humans can apply to be more empathetic? Also, what should we not learn?
Finally, as students, we end with two questions. What will humans teach AI?
Can AI teach humans?
Together, as students, as siblings, and as citizens of the world, we hope to make strides in answering these key questions.
2030 is coming up faster than ever, so it's so crucial to have these actionable conversations. We appreciate you all for engaging in our discussion. Thank you.
Thank you.